talking about some health news this morning. So high blood sugar can cause some serious health problems, including diabetes, really at any age. For women, the risks are even greater. Diabetes increases the risk of heart disease by about 4 times in women, but only about 2 times in men. Women often have worse outcomes after a heart attack. That is why it is so important to get your blood sugar under control. And we want to talk about this further this morning with Dr. Ernst von Schwarz, a cardiologist and stem cell authority. Thank you so much for joining us this morning, Doctor.
Thank you for having me on, Whitney. Good morning to you.
Okay, so first off, we want to talk about what exactly causes high blood sugar levels.
Well, there's 2 forms, if you wish. One is what we call the juvenile or type 1 diabetes, which is often starting in childhood, which is basically a reduction of our insulin production. Insulin is supposed to reduce the blood sugars and prevent basically the deleterious effects of sugar, especially on our blood vessels. And the other one, the type 2 or adult onset diabetes, is usually appearing later in life and is more characterized by an insulin resistance. So we do have the insulin, but our bodies cannot really use it appropriately. And in most cases, that requires medication, and in some cases also insulin. The type 1 always requires insulin to be given from the outside.
And what are some of the symptoms of maybe type 1 or also just any sort of high blood sugar levels?
Well, there's different symptoms. They're very, what we call non-specific. But especially in kids, we always look for things like excessive thirst. They drink all the time because they lose so much sugar and fluid. They dehydrate easily. Excessive hunger, so overeating, could be a sign also. And then later in life, there is actually very rare symptoms. So people can have diabetes type 2 or pre-diabetes and have no clue about it. That's why it's even so important that we do repeated testing, blood testing in particular, to measure our fasting blood glucose levels.
It's really interesting. I had a friend who found out she had diabetes from that thirst symptom that you just talked about. Certainly something to watch out for. And really quickly before we go, Doctor, what is sort of the biggest advice you have for folks just to lower their blood sugar levels?
Well, there's the doctor's care, and there's more important, the self-management. And that's where we come in and try to educate our patients. And it's not only the diet alone. Of course, the diet is important, but there's other things. One thing is, of course, avoid dehydration. I see more and more people with those huge jugs now.
Interesting.
And that's a really good thing. You have to avoid dehydration if you're diabetic. And the other big thing is, of course, exercise. And the recommendation nowadays are 5 times a week, moderate intensity exercise. That means you have to get into a sweat. You have to feel it. You have to get short of breath. Moderate intensity, 30 minutes a day minimum, 5 times a week. And other things, of course, avoid stress, stop smoking, reduce alcohol intake. Of course, avoid foods in heavy fat content and sugar content. And also add a rich fiber diet, because that's very important for your digestive system to get rid of the high sugars.
Okay, Doctor, thank you so much for joining us. All good to know.
Thanks for having me on.
All right.